So when we're talking about blending palpation, it's as simple as thinking of knocking on a door and someone coming to the door to answer to see who it is, and then opening it up to let you come on in. So if you just come up to someone and put your hands on them, like there's a natural, if you notice, there's a natural kind of guarding that goes on. The back will kind of stiffen up a second because the body is like, what is going on? Who is this and what's going on? So with blending palpation, if you take your hands and very lightly touch and then slowly blend in, you'll see the patients will just naturally kind of soften up and relax, because it's like you've knocked on the door and they've said, oh, hi, come on in. And so then you can very easily do whatever you need to do within your screen with that. Versus if I come and just get on like this, no matter, I'm really pushing hard on you, right? And like the body won't respond. But if you come and you gently blend in, then you can take the body and do whatever you want with it, because the body has said, you're here to help me. You're not here to harm me. I don't need to send my friends to guard to prevent you from moving. So the concept of blending palpation is just optimizing the tissue response in the patient's unwritten, not unwritten, but nonverbal response to, you're here to help me. Here, I'm going to help you, show you where the restrictions are. So if you will use that concept, regardless of what technique you're using, regardless of your osteopathic screen, just the simple, anytime you're going to touch your patient, to gently blend in versus having heavy hands, then it will make your palpatory skills go exponentially up, but it also will allow you to blend into the tissues and feel things more distinctly. Another example of that is, for example, with the arm, when you're trying to palpate your different layers. If you're trying to get to a bony layer, so let's say we're trying to get to the bony layer in the arm, if I just get on the arm and I'm trying to take it to that bony layer, no matter how much pressure I put on that arm, it won't let me. I am stuck in the soft tissue and muscle. But if I come and very gently get on and then slowly imagine going through, so I'm going into soft tissue, I can get into the fascia, we're going to get into the muscle. The shoulder just dropped down there as soon as I got into the muscle. And then I can go right into bone, and then I've got a bony lock. So the body will let you go through your different layers much easier. Same sort of concept with, come back around here, grab my little tensegrity model that we talked about. So in a tensegrity system, you've got a balance system. So the heavy hands just coming on and getting on the patient's body with guarding would be the same thing as a compression into the system. And you can see it's so compressed, it's hard to get the adaptations. But if you come into the system and you gently kind of blend in, the whole, as you go in, the whole thing can adapt. But if I do this, I can't get very much adaptation. So the same concept applies to our patients.